Let's dive in and see what my fellow medical professionals are talking about on Reddit. Maybe I can share some of my medical stories. Beep-whoop. Doctors of Reddit, what was a 1 in a million case that you personally witnessed? The only thing that's popping up in my head is when I was giving a patient a cardiac exam and listening to their heart. While I was doing it, I looked at their nails and I caught a subungual melanoma, cancer. That was cool. I don't know if it's 1 in a million, but it's a cool one that pops into mind.
Wow, that's awesome.
Not a doctor yet, but during my summer break as a med student, I have to do something called summer practice. One evening, the doctor I was with decided to do a CT for a patient, and it turned out that he had situs inversus. All the organs are gonna be on the opposite side, liver to the left, heart to the right, etc. One person from 10,000 presented this condition. I think I had a patient with dextrocardia where the heart was flipped. So I think that's pretty rare. Not as rare as all of the organs being completely flipped. The real problem with having your organs completely flipped over is the risk of having an iatrogenic injury. And that means an injury caused by the medical system thinking that your organs are where they're supposed to be, because again, 9,999 will have them in the correct orientation. I don't even know if this 1 in 10,000 is accurate. You will get a procedure and injure an organ. You will get a misdiagnosis because the doctor thinks you have an organ in one place where it's actually on the other. They'll miss an appendicitis because you have left lower quadrant pain instead of right lower quadrant pain, as we typically see with appendicitis. So the hospital risk goes up, but in general, everything else should function quite normally.
Should that kind of person wear a bracelet or something that says, hey, heads up?
In general, wearing bracelets is not a good idea because we don't take them as fact. If you have something tattooed on you, if you have some random bracelet on, we can't go off of that as a true medical accurate statement. If you have a do not resuscitate bracelet on, that could be the name of your band, for God's sake. So if it's not official paperwork, we can't use it. Had a patient present to the ED after a bee sting and a pretty bad reaction. Anaphylaxis can happen after a bee sting. You get stung on the hand, you have a terrible reaction, your throat closes up, you don't have an EpiPen, that could be lethal. We found a softball-sized tumor on workup sitting on her cervical spine. Would have been a quad within a year. That bee sting truly saved her life. I think they mean a quadriplegic, meaning that the mass would have put so much pressure on the spinal cord that it could have damaged it. These types of diagnoses have a name in medicine called incidentalomas, where we will scan your body looking to make a diagnosis. For example, you have right lower quadrant pain and we're trying to see if you have appendicitis, we do a CT scan and then we can find a giant ovarian tumor. A lot of times this happens with lung nodules, and before we had tremendous issues with finding these nodules because they would be asymptomatic, they wouldn't cause any problems, and we'd end up following them, radiating patients. But now we have actual criteria that we use to decide, based on the size of the nodule, how often we should be rescanning them. And after a period of time, if we find that they're stable, how long can we wait before we discontinue all follow-up imaging? Literally saw this with my own eyes. Can you see through other eyes, my guy? Sorry, it's a little medical humor. An ED nurse in Australia was in charge this particular evening when I was called into the trauma room. Sitting calmly on the side of the bed was a middle-aged Polynesian man with a broken pool cue through his head. Is it a Phineas Gage scenario? His surgery took hours because the flattened Q-tip was in danger of clipping a blood vessel as it was being removed. The reverse way it went in. So every moment needed to be checked. His CT scans from there are apparently legendary. Turns out there's a 1 in a billion way of essentially pushing the brain upwards and missing every vessel. A couple of days in the hospital for IV antibiotics, and he walked out with no adverse effects to brain or eyesight. That is unbelievable. That is a 1 in a million story. And it makes me think about that scene with the really cool music from like Ocean's 13 or 14 or 15, when the dude is going through the laser maze, and it's obviously fake and he's just doing some breakdancing and they added the lasers in post. But that is basically how the pool cue went in to this dude's brain, missing all these arteries. Wow. I'm not a doctor, but I work in an ER trauma center doing patient registration, which puts me up close and personal with a lot of gnarly. Interesting way to describe patient care. Gnarly. Gnarly.
Tesla.
Gnarly. Had a patient come in with frozen leg. They were pissed off that the doctor wouldn't amputate a perfectly healthy leg, so they submerged their entire right leg in dry ice for close to 7 hours to force a medical team to remove it. That is unbelievable. I mean, the burns, the pain. I mean, I guess the pain would eventually stop or cease because the nerves would die. The leg was so solid, it made a noise when the doctor knocked on it. I can't even imagine the pain this person withstood. Again, I don't think there was that much pain. It was a case of that rare mental condition in which your brain rejects the idea that your body parts are actually yours. Nobody in the hospital I work with have ever seen a case. I've heard of phantom limb syndrome, where you still think you have a limb that was amputated, but I've never heard of you thinking you have a limb that doesn't belong to you. Should I look that one up? Body integrity dysphoria. People with this rare condition feel a profound lifelong mismatch between their physical body and their brain's internal map. Even though their limb is completely healthy and functional, they view it as foreign or superfluous and may feel an intense desire to have it amputated. We just talked about body dysphoric disorder with Dr. Mike Israetel, and he was incorrectly pointing out that he believed in order to be diagnosed with body dysmorphia, you need to have no insight into your condition, meaning that you would look at your muscles, and if you were really muscular, you would see like noodles or something. And that's not necessarily the case for body dysmorphia. You can understand that this is an outrageous predisposition that you have and that you're actually fine, but still want more and more, and it can cause you dysfunction in your life. That's still body dysmorphia. So you can have a level of insight. Doctors and nurses of Reddit, what have been your why didn't you come in sooner moments, okay? A colleague of mine removed a diabetic's patient's sock and their toes came off inside of it. This is not unusual. Diabetics lose sensation of their distal extremities. The reason this happens is their blood sugar is so poorly controlled, it creates a pro-inflammatory state for the nerves, for the circulation. And as a result, you first lose sensation, then you lose blood flow. And as you lose blood flow, you lose the ability to have your immune system function. You lose the ability to bring oxygen to the tissues, and the tissues start to die off and you feel no pain because the nerve isn't functional anyway. All my patients who are diabetic get an annual podiatry visit and ophthalmology visit for a dilated retinal exam. Don't mess around with diabetes. Make sure that you're on top of your prevention. My cousin is a pathology assistant and was telling me about how she had to dissect a testicle that was 11 pounds. Turns out it was a testicular cancer. You know, ovarian tumors can grow quite large, so I'm assuming testicular cancers can grow quite large as well. A lot of times when a patient describes to me their scrotum is larger or enlarging or bigger on one side than the other, I think about an inguinal hernia, because that's one of the more common conditions that I see, where literally the abdominal contents, the intestines, go through the inguinal canal and end up in the scrotum. Why is that dangerous? Well, because if the bowel turns in a unique way or some inflammation happens in this hernia, in this unique opening, and starts choking out the intestine, you lose circulation and it starts to die and necrose, which can then lead to infection, and infection in an enclosed part of the body where there's no circulation means that it's gonna become a bigger and bigger problem. That's an emergent surgery, which is why we like to take care of hernias in a non-emergent fashion, in an elective fashion, by putting a mesh over that canal and preventing the abdominal contents from falling into the scrotum. Plus, it's a quality of life issue. Years ago, as a nursing assistant on oncology floor, we had a guy admitted because he had an erection for several days and had lost the ability to pee. Well, there's also the problem of that blood becoming acidic and damaging the tissues, harming that person's ability to get an erection in the future. His bladder was close to bursting and his poor junk was, think microwaved hot dog, really bad. Yeah, that is really bad, which is why we insert into the corpus cavernosum a needle to drain that and relieve this scenario from getting worse. And the name of the condition is priapism. You don't need to even Google it. Former medic here called to a patient who had cut their leg while chopping wood about a week prior, and now it was really itchy. Itchy after an injury usually is a sign that something's healing, unless foreign object is present or infection is present, then we need more information. Old gentleman didn't drive, lived alone, got to his house, unwrapped the ungodly swollen leg to find that he tried to super glue the wound closed and maggots had commenced to growing inside. The itching he was feeling was the writhing maggots under his skin. Super glue is not an ideal substance to use because it's gonna irritate the skin. But we have skin glue, so like this isn't unusual. It's just the type of skin glue we use is different than the super glue that's found in your local Home Depot or Lowe's. Maggots technically feed on dead tissue and not live tissue, so they're kind of doing the right job, if you will, but still that's not the right way to heal that wound. And in general, when it comes to healing a wound, yes, you want to change your bandage, but the majority of the day you want that wound to stay covered because a covered wound heals better. Doctors of Reddit, what was the worst thing you've seen for a patient that another doctor overlooked? I've had a patient come in that was morbidly obese, was having pains in their joints, and constantly doctors would blame it on his weight and would just say it's an osteoarthritis, it's a weight issue. And I think that's where the fat phobia that's often discussed in healthcare comes in because it creates a bias. And what was good is by asking him a ton of questions, I realized while he doesn't spend a lot of time outdoors, his dogs do, who sleep in his bed, who transferred a black-legged tick onto him, ended up giving him Lyme. He had a rash that no one caught. We treated that, felt much better, made that diagnosis.
Awesome.
Patient was lactating but not pregnant or breastfeeding. All right away I'm thinking prolactinoma, which is a tumor that secretes prolactin, which can create milk. Previous doctor told her that it was residual from her baby that had been weaned for 14 months, sent her immediately for a brain scan, brain tumor. She had surgery a week later to remove it and was doing very well now. I'm assuming this is a prolactinoma. This is like a doctoral case. I would guess prolactinoma. I work in EMS. We got a call for a female with leg pain. When we arrive on scene, this woman's leg is 3 times the size of her other one, blue and purple, and she has no pulse in her foot. She fell on ice a few days prior. Oh, is this compartment syndrome? And the urgent care didn't do any x-rays, told her she had a sprain, gave her a walking boot. In reality, her tibia and fibula were both so badly fractured, they were cutting off the blood vessels and muscle tissue. That is a full-on medical malpractice case. And by the way, compartment syndrome is where you have just so much swelling happening that it ends up cutting off circulation. That emergency treatment would require fasciotomy, where you'd cut open the fascia, it would spread open, release that tension, and therefore as time goes on, healing goes on, you can then close that area up. But man, in that scenario, how do you miss a tib-fib fracture? That's 2 bones broken. Once when I was a medical student on surgery rotation in trauma, we had a patient come in after he fell on the street and bonked his head. Well, apparently he had fallen once earlier that day and was discharged when the trauma workup at the other hospital was negative for injuries. We examined him and noticed his eyes were kind of yellow. Well, yellow meaning that there's some early signs of jaundice happening there. Some of the easiest places to see jaundice would be in the nail bed, the eyes. Underneath the tongue is a surprising place for some. So as part of our trauma workup, given that he couldn't give a great story and we couldn't be sure what happened, we CT scanned his abdomen and saw that his common bile duct was 3 times normal size, could drive a truck through it. I mean, that's a bit of an exaggeration. About that time, next set of vitals, his temp was 103. Guy was floridly septic from ascending cholangitis, which is why he was falling down. Big miss, and that is an emergency. Every time someone has a fall or presents to the ER or my office as with a fall, we have to describe what caused this fall. That could be musculoskeletal related fall, meaning that they missed a step and they tripped. These types of mechanical falls can make sense. But now if someone is just walking and all of a sudden they collapse and fall, this is not just a fall, this is almost a syncope or a near syncopal episode that warrants investigation as to why the heck this person syncopized or nearly syncopized that led to this fall. Doctors of Reddit, what's the biggest case of faking it you've ever seen? What happens more often is a patient wants a medication that was going to be used illicitly or not for its intended purpose. And that does happen. So in those scenarios, you have to be very careful and thorough in establishing clear guidelines with the patient about what's acceptable, what's not. You end up signing a controlled substances agreement, which has all sorts of rules in place about not going to multiple doctors to get the same prescription, not filling in randomly different pharmacies. And we can actually check this as part of our monitoring service before we prescribe the medication, along with potentially checking urine or blood tests to see if they're taking the med. Sort of along the same idea, working at a pharmacy, we saw a guy come in trying to get a refill of some pain meds that he had no refill. After pleading that his ear really hurt, we told him again we couldn't refill it. One of the other employees saw him step into a side hallway and take a pencil and jam it forcefully into his ear, repeatedly drawing blood. He calmly left and went to the ER. He came back a few hours later with a prescription for pain meds. That is wild. And what you should have done in that scenario is called the ER when that happened, as well as the local police department, because that is not good for the medical system, nor that patient. And you want to be an advocate for that patient. I know many providers would just shrug it off and say, look, they have a note, they have a prescription, so I'm gonna do it, and I don't wanna go the extra step. But do it, help the person out. Nurse for an ophthalmologist here. Oh, I just had an interesting case, ophthalmology speaking wise. Patient comes in for a rash on their face. As soon as I walk in, I sigh. Why do I sigh? Because it's 4 p.m. and I immediately know that he needs to see a specialist urgently, given the fact that this condition needs an ophthalmologist to guide us on treatment. What condition, you might be wondering? Good old shingles. Reactivation of varicella zoster, but was on his forehead, crossing the eye, creating redness and irritation in the eye, which could have been uveitis and all these other conditions. So right away, I had to explain to the patient that I think this is shingles, and if this was on any other part of his body, not touching his eye, we would give an antiviral medication, acyclovir, valacyclovir, one of these options, and you'd be totally fine. But because it's impacting the eye, I know we need an urgent ophthalmologic investigation. Being that it's 4 o'clock, I was very worried that I was gonna have to send him to the ER and waste his entire evening. But fortunately, I was able to call a local ophthalmologist, speak directly to his staff, who then spoke to the doctor, explained the scenario, and were able to hurry the patient out and make it just in time before they closed. They were able to see him, got him taken care of, got him the correct medications, follow up the next week. It was like the perfect healthcare system outcome for a scenario that could have been terrible if he didn't have it evaluated, or if we sent him to the ER and he had to sit there for hours at a time for no reason. 21-year-old patient to be completely blind from a sudden and severe glaucoma diagnosis from a previous unknown doctor. Would feel around while walking, tried to keep eyes rolled back into head, the whole 9 yards. He said he's a famous YouTube rapper that is now unable to make videos or earn a living. I exclaimed to have heard of him before and very excitedly asked him to search and show me his YouTube channel on my phone so that I could subscribe. Great test there. He took my phone out of my hand, effortlessly found the YouTube app and typed it away in the search bar. Oh, and of course his eyes were back to normal and focused. He did ask for a letter for his parole officer that he could use marijuana to treat his glaucoma. Bummer, he did not have glaucoma, and medicinal marijuana is illegal in the state of Texas. I wonder if that's still true. Yeah, that's not an ideal scenario, but at the same time, you don't want a scenario like this to lead you to becoming jaded and cynical and make the assumption that patients are coming in like this, because if you lead with that assumption, it's only gonna hurt you as a provider. You're gonna lose the humanity that is so important and so valuable in healthcare. ER nurse bringing a patient back to a room who said he had kidney stones. I had to stop him at the bathroom to get a urine sample. Dude comes out with a specimen cup that literally had a piece of concrete in it. Looked him in the eye expecting some sort of joke. He was serious. I threw it away and walked his dumbass back to the waiting room to contemplate his stupidity. I don't understand, was he trying to get pain meds for saying he had a kidney stone and he put a piece of concrete in it? I mean, imagine that was a true kidney stone. I mean, I don't know how big the concrete was, but we've seen kidney stones in our patients form to the size of lemons. Like, they're wildly big. And obviously in those cases, it's a surgical intervention, but still. Taking trauma call during surgery residency, had a prisoner come in after a fight and claimed he couldn't move or feel his legs. All the CT and MRIs were normal, but we would shield his legs so he couldn't see them and poke them with needles and other sharp objects with enough force to cause pain. He never flinched or moved his legs at all. He was diagnosed with SIWORA, spinal cord injury without radiographic abnormality. He stayed in the hospital for a week, no improvement, always had one guard with him. One night they were down in the lobby watching some television, but the guard needed to use the restroom. The patient said, "Where could I possibly go? I'm paralyzed." Guard left him alone for 2 minutes. Patient last seen sprinting down the road, naked butt cheeks flapping in the breeze, made it to the city 4 hours away by car before he was caught again. I've never seen anyone fake it so well, truly playing the long con. I mean, that's an interesting case of malingering, that if you're poking someone with like a monofilament or the sharp edge of your reflex camera, which like if you do that as a scratch, like that's not comfortable. And they were able to tolerate that and fake it. If I'm pressing on my patient's point where they're saying it's painful, and they're like, yeah, it's really painful there, and then I start distracting them, asking them about something else, and keep pressing, and they're no longer having that same reaction, I will point that out to the patient, asking them why they think that's happening, because that's an important part of an objective physical exam. Some of these were failures, but do you want to hear the worst medical failures in history? Like true scandals. Click here, check that out, and as always, stay happy and healthy.